that service standards are met when patients receive, let's say, medical services from within the setup. Now, whether it's National Health Service, whether it could be, community health services, it could be mental health care services, service standards are met. It could be related to, providing services to the vulnerable. It could be clinical care services. It could be services which are normally given out in care homes and things like that. So generally speaking, when we talk about, in general, health and social care, and when we talk about quality, looking at specifically the perspective of quality, we are essentially looking at, talking about, the parameters in terms of how integrated care, person-centered care, and quality of care, to a certain extent, the degree to which these health and social care services are provided to individuals within a particular setup. Now, whether that's a local setup like a care home or a hospital, or a GP from a GP surgery or a community service. But in general, we are looking at the quality of care, which is primarily the degree to which these services are provided to individuals, and obviously in general, in terms general populations, and their likelihood of achieving the desired outcomes. So it is based on, ensuring that the policies, processes, and legislation which is enacted within this particular field is helping to deliver the quality of care which is safe, effective. It is patient-centric, or person-centric, as we say, person-centered approach. It's timely, it's efficient, and it is, obviously providing, the benefits to the individuals who are receiving this care, so that they can get back on their feet. And obviously, or if they had, say, for example, if they've had an operation, or if they've had a procedure done, then they would essentially be looking at, getting back on their feet as soon as possible with the help which is being provided, from the health and social care setup. Now, quality in general as a word, when we look at, is going to be repeatedly coming in relation to health and social care within this unit. And the idea here would be that when we look at studying this particular unit, quality, managing quality, we are looking at how does a government, in this case, Department of Health, is able to, become a powerful driver to create what are called policies, procedures, which are going to help in delivering high quality care that is effective, that is patient-centric, that is timely, it is efficient. And when we look at, say, for example, in the context of, because in the United Kingdom, when we look at, we have England, Wales, Scotland, and Northern Ireland. So, but if I look at specifically, say, the NHS in England, it talks about organizing itself around a, single definition of quality, which means that we are looking at care which is effective, it is safe, it is person-centric, and it provides positive experiences for people to be able to get better or get well soon if they are in the hospital or in a particular setup to receive care. Now, when we talk about this particular unit, we are going to be looking at covering in 4 learning outcomes. It has the first learning outcome, understanding different perspectives of quality, and in relation to health and social care services, which is where we will dwell into a bit more detail currently. The second learning outcome is going to be talking about strategies for achieving quality in health and social care services. What are the various strategies put by the Department of Health, NHS England? When we talk about the PCCT Trust, we talk about certain external agencies like CQC, NICE, the King's Fund. What kind of strategies, or essentially, let's say, white papers, best practices they come out with, which are then implemented sector-wise, in order to ensure that these services being delivered are quality services and they are beneficial for the patients. The third learning outcome is going to be looking at evaluate systems and policies and procedures. So we'll be looking at understanding what are these policies and procedures are in quality that are implemented within a health and social care setup. So we'll take up some examples of policies, actual policies, and see how they are implemented within a particular setup, and how these policies and procedures, legislation, laws, and acts essentially help in ensuring that integrated care is provided. The care which is being provided is safe and effective. It has the basic bearings of the care being person-centered. That means it is meeting the requirements of the patient, and then looking at how these policies and procedures are implemented to ensure that the quality of care being provided does not slip. It meets the basic standards which are set by CQC, and that is what we are going to be looking at covering in Learning Outcome 3. The Learning Outcome 4 basically looks at understanding methodologies for evaluating health and social care service in particular. So this is where we will be talking about the service model, which is called ServiCall. And when we talk about the service model here, we are going to be generally discussing the approach, which basically looks at meeting the demands of the National Health Service, the policies, procedures, the white papers, the government acts and legislation which are put into place, how they look into the aspect of providing and helping develop a service model which basically helps meet the requirements of the patient within the NHS or within the National Health Service. Now, when we talk about the service model, ServiCall, we will look at this from a theoretical perspective, because when we talk about service and the quality of service and maintaining that quality of service, the ServiCall, which is Service Quality Gap Model, is an approach that we need to be aware of, and that approach helps us in measuring service quality that will be utilized by you as managers in implementing and upkeeping and also ensuring the standards required within your health and social care, say, setups, whether it's a clinic, whether it's a care home, whether it's an old age home, whether it's hospital surgery, and how do you look at maintaining those standards using the ServiCall model, because that model specifically is a service delivery model. Theoretically, you need to understand that, and using that model, you'll be able to understand the gaps which are between the expectations and how these services are essentially being offered. So you'll be able to discover these gaps using that particular model. Now, there's a fair bit of content to be covered specifically in the first learning outcome that we're going to start with today. And I will switch you over to a presentation slide. The idea here would be to discuss the first learning outcome, which is to look at understanding the different perspectives of quality in relation to health and social care services, specifically, with regards to the, health and social care sector. So we are going to be looking at quality, but quality being, a vast topic, but we are going to be contextualizing quality in the context of health and social care in particular, and this will be the objective of studying this particular unit under health and social care diploma, because some of you are acting as compliance managers or are working or taking a role of a compliance manager or a registered manager. And as a person responsible for maintaining, implementing, and upkeeping the standards required to be delivered for care within a particular setup is going to be your direct responsibility. So understanding how quality is managed, how quality is maintained, and how the policies and procedures within the quality side of things are implemented within a setup is going to be important. And this unit is going to be focused on discussing that. Now, when we start this particular unit, we are going to be looking at a couple of things to set a foundation of understanding what is quality in context of health and social care, and then what will be essentially the remit of we studying some of the aspects of quality and relating it to the learning outcomes of this particular unit, which is managing quality in health and social care. Now, the first learning outcome content essentially covers a couple of things, which is related to understanding different perspectives in terms of what is the definition of quality, how does it affect, say, for example, various stakeholders within the organization. And, we look at external agencies that we need to be aware of, which basically create benchmarks for quality to be, and processes. When I say quality means benchmarks, they create for the organizations to follow the implementation of quality policies and procedures within their organization. So we'll be looking at briefly understanding the role of CQC, what is CQC, what is NICE, NICE as we call it, the SCIE, role of healthcare commissioners, which is pretty much now, taken over by CQC, but because it's been mentioned as the indicative content, I would mention them briefly in today's discussion. The role of local authorities, councils, in particular local authorities, which are responsible for, implementing and enacting the policies which are developed at the national level and the regional level. And they are basically responsible for now implementing these within the various setups that we get to see. So if I look at Manchester, for example, Manchester has maybe 3 different trusts which basically run and provide these services. So there is Manchester Infirmary, there is Wythenshawe, there is Greater Manchester Northern Hospital, and then you have outskirts of Bolton and Bury, which are also a part of this particular trust. And when we look at Greater Manchester Combined Authority, we'll be probably looking at, authorities in Wigan, Stockport, other areas which are going to be responsible for implementing some of the national and regional policies in these setups to be able to provide, services to patients. So when we talk about these, that is what we are looking at covering from an coverage of understanding, local authorities. We'll very briefly look at how charities, because some of the charities essentially are funded by the government. They receive funds. They work in partnership, close partnership with public and private bodies, and they are a key cog in terms of delivering care towards the last mile to patients, within local areas. So we look at an example of a local charity like Age UK and their role in terms of implementing these standards for the purposes of maintaining quality when these organizations deliver care services to patients. Then towards the end, we look at briefly understanding the impact of how, when these quality policies and procedures are implemented, what is the kind of impact it has on the delivery of quality and care, essentially to patients within this particular setup. So a fair bit of content to be covered in Learning Outcome 1. I've got a couple of the slides that we will look at for discussing today's learning outcome. But let's start up with a general video that we want to look at from a point of view of understanding what do we mean by quality of care. And this is the term that we are going to be using time and again. So what we want to be able to do is look at a short video which will help us understand what does the quality of care mean in the context of this particular unit. So let me switch you over to the video, and let's listen into this short video to understand what is quality of care. So let me just restart this from the beginning.
Everyone needs access to healthcare, but just because a patient has been treated, it doesn't mean their condition will improve. In fact, when care is not of sufficient quality, treatments may not work or could even cause harm. Around the world, more deaths are due to poor quality care than lack of access to health services. 15% of deaths in low and middle income countries are caused by poor quality care, and in high income countries, 1 in 10 patients are harmed while receiving hospital care. The need for action is clear. To make sure that health services provide quality care that improves people's health, care should be effective, so you accurately diagnosed and receive treatment that works. Safe, so the healthcare that you receive doesn't harm you. People-centered, so decisions made about your care are tailored to your needs, and you're treated with compassion. And timely, so you receive care when you need it. It should also be equitable, so all people receive the healthcare they need. Integrated, so different health workers and facilities all work together to improve your care. And efficient, so available resources are used more effectively to improve your health and avoid waste. WHO is calling on countries to take action on quality of care and is working with them to develop policies and plans so that all patients are cared for in environments that have the right infrastructure, and health workers are well trained and given the time, resources, and support to provide quality care. We're encouraging governments and health organizations to listen to the people and communities they serve find new ways of relating and working together, and learn from failures and successes. WHO is also supporting countries to take early action on critical areas like maternal and child health, patient safety, infection prevention and control, and water, sanitation, and hygiene. While action and quality is needed around the world, we also have a particular focus on fragile and conflict-affected settings, where the need for healthcare improvement is often urgent. We are working with partners towards the Sustainable Development Goals, which stress that quality is a key element of universal health coverage. In the words of the WHO Director General, quality is not a given. It takes vision, planning, investment, compassion, meticulous execution, and rigorous monitoring, from the national level to the smallest, remotest clinic.
So that is where, if you see, this is a small video which is actually focused on talking about, the quality of care, which is what the World Health Organization actually looks at prescribing. So if we just go back now, to essentially the, PowerPoint presentation to discuss in general about, some of the bits related to quality and how do we relate it to, health and social care in particular. Now, when we look at, definition of quality, in terms of looking at, what does quality mean and, how does it relate to patient experience when we look at putting some of these policies and procedures in place for the purposes of maintaining quality of care. Now, when we look at these, as you can see, the Institute of Medicine, sees quality as a degree of health services which are provided to individual and populations and their increased likelihood of having the desired health outcomes, which are in consistence with the current knowledge available in this particular field. That is to say that we are able to deliver services which are providing and are focused on healthcare delivery in terms of ensuring person-centered approach. They are effective, which was talked about in the video. They are efficient. They are provided timely, and they are provided in a way which is safe for the patients, and they are also sustainable. That means these services primarily tend to be, they are going to be provided time and again, and the sustainability of these services have to be looked into to ensure that we should be able to run and provide these services through various domains. That means through primary care, through secondary care, through tertiary care, and they are delivered to individuals and populations in general so that they are able to get back or, get well soon or, recover from a particular condition. And when we talk about these, basic factors in terms of how we look at maintaining these services, that is where we refer to the aspect of quality. Now, one of the things when we look at quality is, defined by Berwick as doing the right thing for the right person the first time. And when we look at quality things that we do when we look at referring to or do reference to quality, we are looking at basically policies and procedures and implementing them, which are going to create measured results. They're going to obviously look at creating satisfaction in the target consumer's mind. Generally, the definition, as has been defined, or basically the product or the service that is being provided actually creates the satisfaction in the minds of the consumer. Their explicit or implicit needs are actually satisfied, and it reflects their, expectation of what they would want to get from the product or service that they are actually paying for. And this bit is then looked at contextualizing in the field of I would say health and social care. So when we look at this with marrying this particular thing, this definition of quality within health and social care, we basically then define it in the context of patient experience, effectiveness. We look at talking about efficiency, timeliness, safety, and sustainability. And these are the qualities that we will look at when we essentially look at putting quality of care in the context of any social care setup that we talk about. Now, let's also look at some of the keywords. Where do you think quality comes into play when we hear some of these keywords. So, for example, an adverse event has happened. We have had a case of a medical injury, or when we talk about, there is a medical error which has happened, or there's an error which primarily has happened because of negligence. We talk about, we read and obviously hear about a lot of negligence malpractice which has happened within the NHS. Sometimes we do see doctors being debarred from the Journal Medical Council to be able to privately practice because they have not followed the correct procedures in providing and delivering the care required for the patients, and that has led to problems or complications. So one such case that we hear, which obviously has a far-reaching complication, for a French company which had created breast implants, and if you look at that in particular, there are 35,000 women which are affected in the UK, and the PIP plants which were used for breast implants have caused severe discomfort to people or women in particular who have had these implanted, and the risks to these implants which were done were not taken into consideration. Things like the bursting of the PIP implant leading to development of cancer or complications within patients, and that is where negligence can come in due to malpractice. That means proper practices and proper methods have not been followed in terms of providing a procedure when conducting a procedure like this. Medical mistakes, obviously, sometimes you would see that certain services or certain types of practices are put into place and they are delivered, but over a point in time, if we discover that these practices and these services, or certain type of services being provided, maybe even a medication, for example, has led to adverse consequences over a period of time, then in those cases they are termed as medical mistakes. Lapses, which are basically, when we talk about lapses, we basically mean a brief or a temporary failure, which could be a lapse in terms of operation. So, for example, when we talk about doctors being overstressed and stretched essentially in the National Health Service nowadays, leading to mistakes which can happen if they're operating. Lapses of concentration can lead to failure and can lead to fatalities essentially in patients, an increase in the number of patient deaths, and they could be termed as lapses. So when we talk about these words, or these words when they are referred to in the context of health and social care, they tend to evoke important procedures which haven't been followed, or guidelines which haven't been met or have not been adhered to, and that is where the context of quality comes into health and social care. So when we have an adverse event, when we have a negligence, when we have a lapse, and it leads to a bit of when I say lapses of these lead to fatalities or problems which are getting created, then in those cases what you will generally see is that the context of quality is introduced. Now, when we talk about quality, we also need to keep in mind that when we say quality, quality does not mean that it is related to health and safety. Quality does not mean that it is related to environmental protection. Quality does not mean that it is looking at sustainable development. It is working very closely with some of these standards which can be related to the care being provided to patients, but it is not entirely in its entirety termed as quality in general. So quality in terms of health and social care would be looking at things like patient experience, effectiveness, efficiency, timeliness of being able to provide medical care which is safe and sustainable, but it will not in isolation be that quality is related to health and safety procedures or environmental protection or sustainable development within health and social care. So just to keep this in mind in terms of context. Now, after having understood briefly about quality, what we also want to do is generally get into some of the broader definitions and understanding of what is quality management, what is quality management in health and social care, and who are the stakeholders or people who are generally responsible for maintaining or upkeeping quality and standards within a health and social care setup. So when we talk about quality management, and the reason why we use the word management is that we are looking at creating or referring to a system which is going to be used for basically designing, at some stage implementing and upholding these policies and procedures which are critical for providing care to the patients. So they would be things which are related to processes, policies, and they are going to be making sure that the care standards do not drop, and when these standards are implemented, the desired outcomes are achieved. Now, when we talk about quality management in healthcare, we are looking at implementing some of these policies and procedures to reduce cost. We are looking at implementing these policies and procedures in general within, within, say, for example, the setup, to ensure that we get the desired outcomes which are, required as per the guidelines which are set by CQC. Now, when we talk about the three components of quality in health and social care, we talk about that when any department, any setup, any outfit delivers healthcare services, they are going to be focused on delivering these services which are going to be effective, safe, and they're going to be person-oriented or people-oriented. And this is what is the core essence of quality within health and social care. Now, the last bit that we want to look at is what are the key stakeholders in health and social care sector. So when we talk about key stakeholders, it's going to be patients. It is going to be NHS. In the case of UK, National Health Service is going to be various other organizations and agencies which basically are responsible for providing these health and social care services. Some of them could be regulators. Some of them could be, agencies which work, in close relationship with the National Health Service, the Department of Health, and the key regulators like NICE, CQC, and some of the local authorities. And some of them would essentially be public-private partnerships which are responsible for delivering, ultimately the services in the last mile to the patient. Say, for example, GP surgeries, pharmacies, community healthcare centers, and they would be all, an important stakeholder within the delivery of these services when we talk about quality. Now, when we talk about the health services sector, or health and social care services sector in general, there is a key reason why there is a requirement for quality management and how it needs to be interpreted. Now, when we talk about, there are three reasons that I've taken in particular, and if I bring them onto the same slide just for easy, discussion. So when we talk about the three reasons which are essentially, why health and why quality is introduced within the health and social care sector, is because of the fact that when we talk about providing care, and when we talk about essentially delivering care to patients within the sector, we are basically looking at ensuring that at some stage the care is characterized by physical and mental involvement of the patient who is receiving this care. And the provision of care is based on a continuous interaction between the healthcare professional, the provider, the provider's family, and in some cases, when we talk about, the close relatives or, people who are responsible for delivering this care to the patient. The second reason that we talk about is that when we talk about delivering care, the patients have very little knowledge of what could be the professional aspects of how these services could be delivered. For example, if we are looking at somebody undergoing an operation, there is a proper preparation which is done, obviously, with the meetings, prior to this procedure taking place, a clinical procedure taking place, in this case, a consultation with the practice nurse, maybe with the consultant surgeon who's going to be operating, to make sure that you are aware, or the patient is aware of, all the required requisites for the procedure, the outcome of the procedure, what could be the complications and what could be the drawbacks or effects of undergoing this particular procedure. And then it also talks about the care, aftercare, which is provided to the patient in terms of recovering from the procedure which has happened. So here the input on choices from the customer, in this case the patient, is taken and ensured that there is a continuous bond which is created between the patient and the professional who is delivering this particular service, and to ensure that the choices made by the patient are actually taken into account while while the patient undergoes this procedure. So it is person-centered approach. It is with the idea of providing due knowledge and information to the patient so that they are able to make a decision. And once they are able to make this independent decision, those decisions taken are then taken into account as per the let's say the requirements of the patient while the patient undergoes this particular procedure. The third reason could be when we talk about some of these healthcare services, there is a close involvement of third-party providers or partners in terms of delivering this care. And what, as a provider, as somebody who's providing primary care, has to ensure that if this care is then at some stage given off to a private provider or a partner, then they are also looking at meeting the same quality standards which are required for them to deliver this service. So, for example, what happens is if you break a bone and you have a plaster that is put on, you receive this primary care from the hospital, and essentially when the plaster is put on, you receive proper, say for example, essentially proper care from, say, the hospital. And once it needs to be replaced, the plaster casts are made, and obviously measurements are done. And then once this is needing replacement, it is done, for the, say, foreseeable 4 to 12 weeks, generally speaking, by the hospital or the nurse or the department which is providing this care. But then once the plaster comes off, if the care in terms of, physiotherapist or an occupational therapist is then provided through a community care support center, wherein you go in and obviously, look at making sure that you're able to recover and gain the full mobility in your arm or your leg where the plaster was essentially done. And that is offered through physiotherapy sessions through a local community center. Then in this case, that provider will also be looking at adhering to the same quality guidelines and procedures which are required in terms of the main provider, which is the place, the NHS, where you got the plaster or the cast put on, and they follow the same procedure and maintain those policies and procedures to provide the quality standard, the quality of care which is required for you to recover from that condition. So these are generally the three broad requirements that we look at. When we look at talking about implementing quality and quality management within the health and social care sector. So in terms of healthcare services, in terms of using the person-centered approach, in terms of ensuring if there are partners and suppliers involved, they follow the same they follow the same policies and procedures as set down by the primary care provider. Now, any questions on this so far, please feel free to ask me through the chat route, or essentially, stop me so that we can discuss and, I can clarify if required some of these with additional examples. Now, looking at going into the first assessment criteria, which talks about explaining the perspectives that stakeholders in health and social care have to, look at when they are looking at maintaining quality. Here, we are going to be talking about the various stakeholders. So if I talk about stakeholders, in healthcare in particular, we are looking at talking about stakeholders which are going to be, for example, patients. If you think of who are the stakeholders, people who receive care, number one, the patients. We look at healthcare providers, which could be essentially professionals or people or sectors or facilities that you're going to be looking at receiving this care from. We're going to be looking at government, which is a facilitator in this case, or a stakeholder, which basically looks at defining laws, legislations. In the UK, essentially the budget for the NHS. We look at public authorities. We look at regulatory agencies. We look at obviously wider industry or fraternity, which is involved in research and, in general, community services, and obviously to a certain extent, pharmaceutical companies. So there could be a lot of stakeholders which are essentially, responsible, or related to quality in general when we talk about quality management within health and social care. Now, the ultimate objective of these, stakeholders which are working together to provide integrated care or, quality of service to patients, essentially is to ensure that they are able to follow these appropriate procedures, policies which have been laid down by, regulators, by, agencies, in order to ensure that the operations and the modalities which are basically conducted or, using the process of, modalities which are essentially, I would say, conducted with the processes in mind to ensure that the quality outcomes are, essentially provided. Now, when we talk about stakeholders in particular within NHS, we would look at them being prioritized into, stakeholders which are basically, let's say, people who are looking at monitoring, people who are looking at informing, people who are looking at managing, and people who are looking at actually meeting the requirements by satisfying the, let's say, the outcome or the medication which is given to the patients. So this particular, grid that we talk about is the grid which we look at in particular, by using this grid, we look at basically classifying the stakeholders, within health and social care. So when we talk about them, first of all, we talk about service users. So if we look at an example of a care home, when you look at people or residents within the care home, they are the ones which primarily are going to be receiving the care. And if they are going to be receiving the care, one of the key aspects that I would look at within this would be that they would expect respect to be delivered or provided when this care is being provided. So if we have an example of, say, Mr. and Mrs. Happy, essentially being addressed as residents of a care home, then you are looking at them being, respected, them being looked after in a way wherein their personal preferences are taken into account and their privacy is maintained, their dignity is maintained. This would be looking at conforming with their wishes, and they, at the end of the day, would feel that the service that they're receiving within this setup is meeting their requirements, and they would be one of the key stakeholders which provide feedback to various authorities towards the end of the year reviews to ensure that they are happy receiving these services within a care home. So for the purposes of, stakeholder analysis, the idea would be to try and keep an organization in mind. And I've looked at a care home in this case to be able to look at who are the key stakeholders, which are involved in, the health and social care setup. And that is where we will look at discussing this as a perspective. Now, the other bit that we also look at when we talk about, stakeholders and their perspectives in quality of health would be that they would be looking at also being informed on the choices that they can make when, they are getting these services within the setup. So, for example, again, referring to the care home, within the care home, obviously, the choice of food, the drinks that they get, what kind of activities they do and participate in is something which is taken into account. And this allows the residents of the care home to be able to essentially maintain what is called, or provide them essentially choice, which allows them to, be happy. And, the services then in this case being delivered, are meeting their expectation. So in this case, when we talk about, choice is one of the key factors which the perspective of, stakeholders will be looking at. When we talk about confidentiality, that could be another factor. It could be family and friends visiting hours, for example, for these residents or old age people within the care home, and their visit hours. And if they are able to meet their relatives on time, they're able to spend time with their relatives as agreed as per the schedule, would, obviously be looking at, ensuring that you are taking care of the customers or patients in this case and their personal requirements. Confidentiality, could be self-explanatory in the sense that anything which is concerning a particular residence or a service user is kept private. The conversations are kept private, and they are kept confidential unless for medical reasons or reasons of consultation, they have to be disclosed to family and relatives, or, essentially medical staff, which could be a nurse or a doctor, in order to discuss conditions so that, proper and appropriate service could be provided. Safety is another aspect that we talk about, and we look at these being the 5 fundamental areas in which, when we talk about stakeholders, we talk about service users, and within service users, these service users adhere to these 5 basic qualities when they look at providing service to, residents or users within a care home. Sorry. The second one that we look at is carers. So when we talk about carers in general, the second stakeholder that we look at is carers. So when we talk about carers in general, we are looking at here being staff, essentially, who are professional staff like healthcare professionals, healthcare assistant, nurses, doctors, who are essentially involved in delivering this care to the people within the care home, would be looking at as second, major stakeholder. So when we talk about getting their perspective on, what could be the aspects of quality and how they consider quality, they would be looking at things like, equity. So when we talk about, their aspects in terms of considering, essentially quality and quality aspect of it, they would say we are looking at considering equity as one of the examples. That means all providers should be, treated equally regardless of their race, ethnicity, gender, or knowledge, or, background. And their job should be essentially to put this into consideration so that, the care home or the people who are involved in delivering the care to the residents of, the care home are not bogged down by, aspects of where you come from, or what knowledge do you have, what qualification do you have, and what experience do you have, and things like that. So equality amongst the individuals who are involved in delivering this care as a carer to the patient. Second is safety of both the patients, or in this case, residents who are people who are resident in the care home, and safety with respect to the staff, which is delivering. When I say staff, I mean carers, which are delivering the various services to the residents of the care home. And this would mean that we are talking about ensuring that the environment is safe standards are implemented, health and safety is taken into account, proper procedures and policies are followed. Things like during COVID, if you relate to a lot of staff, complained in care homes, and care homes had a large number of deaths. The number of deaths in proportion to care homes in other developed countries was significantly higher in the UK, is because of the shortage of personal and protective equipment, PPE. And a lot of carers essentially lost their lives because they contracted COVID from patients who they were providing care for. So ensuring that PPE was made available in abundant quantities so that it could be used in providing and taking care of the residents during the COVID pandemic would have helped save a lot of lives. So in this case, when we talk about safety, we're looking at ensuring safe procedures, equipment and other, say, for example, bits are available, which could be, training, it could be related to equipment, it could be related to proper funding, and that is available to be able on, and the ratio of the number of carers to the patient. So whatever is defined as per the standard is available, so that the people who are working as carers providing care to the patients or residents of the care home are not overworked, overstressed, and due equipment. And, in this case, an example of personal protective equipment was made available. If it was made available in time, the number of deaths for carers would have been less. And this is an example of their perspective on safety. So looking at equality, looking at safety gives us a perspective on some of the stakeholders which are involved in health and social care, and what is their context of discussing quality with regards to implementing it, and what does it stand for when we talk about quality from their aspect. So this is an example of looking at covering, I would say, the bits on the perspective of, health and social care, perspective of quality within health and social care. Now, you could also have, perspective of technicians, people who are involved in, say, for example, looking at providing some of these services. And I've just put in an example, say, people who are responsible for dealing and working with equipment like X-ray machine or an MRI scanner, or, some of the other related equipments which sometimes you're referred to go to hospital to get a treatment done or get a scan done, and their perspective on quality, for example, radiographer or technicians which are involved in doing a mammogram, a breast scan, an X-ray, they would be looking at the basics of training being provided to be able to work effectively while conducting and providing some of the services to the patients. And that would be giving you an idea of perspective of quality with regards to key stakeholders within the health and social care setup. Now, any questions on this, feel free to ask me. Now, we'll also go across to the second assessment criteria, which is analyze the role of external agencies in setting standards. Now, before we get into this, let's briefly understand who are these external agencies and what is their particular role. Now, when we talk about external agencies, they are agencies or bodies which regulate quality of care and the standards which are effectively delivered while providing these services to the patients. So these main agencies that we talk about are the Care Quality Commission, CQC as we call it in short. Should mention that CQC. The National Institute of Health and Clinical Excellence. We have the Social Care Institute of Excellence. There are other bodies like the King's Fund, the Health Foundation. We have Health and Service Care Professionals, which the role of them. The health service commissioners have been merged with the CQC in 2009. And then we have local authorities and obviously working of certain charities which work very closely with some of these bodies to ensure that the quality standards are met, the benchmarks are done, and then obviously, in some cases, these agencies also look at going further, wherein they would be working as a non-governmental body, non-departmental or non-governmental body, and they would be responsible for creating new standards which are required to be followed by various providers within this sector. Now, let's briefly look at, CQC. So when we talk about CQC in general, the Care Quality Commission, they are an independent and a non-governmental body which basically is responsible for setting standards in health and social care in England and in Wales, in the UK in general. Now, they are regulated and they are basically totally independent, and they would provide, essentially, let's put it this way, services which would primarily be responsible for setting standards, creation of standards, study of particular standards or codes of practices, as we would call them, primarily to ensure that services being delivered by any particular setup within the sector is meeting certain compliance, is meeting certain guidelines, and the legislation and act which has been put into place by the government. Now, there, if you need to look at studying CQC in particular, there is, let's put it this way, a lot of, there is a specific website for this particular body, and this particular body is primarily focused on establishing practices which will be looking at obtaining, handling, using, and disclosing, let's say, standards which have to be followed by various organizations within the health and social care setup. Now, their aim is to make sure that voice of service, voice of users is essentially taken into account, which is when I say voice of users, I mean patients is taken into account while these benchmarks and policies and procedures are set to provide these to provide patient care services. It also has the authority to restrict services, inspect these, any facilities once in 3 years or 4 years. And it also has the ability to be able to restrict these services if you're not meeting the quality standards, can ask you to put a corrective action plan in place. And if the plan is not in place, put in place in time, fines can be levied. And finally, the services of that organizations can also be curtailed, or they can be asked to close down if they are not meeting the guidelines set by CQC. The second particular aspect that we look at is NICE, which is the National Institute of Health and Excellence. Now, they are an independent organization which is responsible for creating national guidance on how promoting good health can be done by preventing and treating ill health. So when we look at the LIFE campaign, for example, when you talk about the life in general, obesity campaign, for example, some of these campaigns that we look at, which are run from time to time by the National Health Service, or certain key organizations within the UK, and the study of their impact on how it can help in promoting and preventing essentially, heart diseases, or say, for example, high cholesterol or healthy lifestyle, is what the NICE would be looking at doing. They would be working very closely with service providers to ensure that the guidelines that they create through training toolkits to, for example, best practices are adhered to, and they help in generally maintaining a good lifestyle or a healthy lifestyle within a population, within a particular setup, or within in the context of UK. Now, the third body that we talk about is Social Care Institute for Excellence. This particular, independent organization was established in 2001. They were a part of government strategy to improve health and social care provision and practice. They work very closely with the Department of Health, and they look at essentially, identifying information which could be good for research, for examples of best practices or good practices shared. And then they also develop proposals for further research, which would help in informing good practice that can be implemented across the NHS. Now, when we talk about the National Institute of Excellence in particular, they are largely a government-funded body, and they are operating both at the local level, at the national level, and also in helping the government in let's say setting and defining policy, which could then shape how future services are provided in, within the UK. They essentially help in undertaking what is called the improvement, projects. They also work collaboratively with a lot of other organizations, in which basically are also promoting better care, or looking at administering better care for young vulnerable adults, young people, and also for children. And they are also involved in continuously developing a range of commercial products, projects essentially, and in research, in order to come out with and inform, say, for example, various organizations on good practice within this particular sector. Now, health and social care, health service care professional, commissioners essentially was a body which was set up by the government in 2004, but later on it was merged with the Quality Care Commission or Care Quality Commission in 2009, and it was primarily responsible for ensuring standards within the NHS. Now, the NHS Act of 2010, when it was introduced, also contributed to this being merged with CQC, because CQC became essentially the main body which basically looks at maintaining the standards within the health and social care sector. So this particular agency or a body, which is Health Service Commissioners, is no longer in existence. It is now, the role of this particular body has been merged with CQC. We talk about local care authorities or local authorities in this particular. They represent local communities, essentially, which make up councils, setups, or when we talk about the PCCT trusts in particular, in the in the structure of when we talk about the structure of the NHS. So when we talk about this particular structure within the National Health Service, we look at basically ensuring that some of these bodies essentially look at delivering these services, which are basically, when I talk about PCC trust, they are basically the primary care trusts which are set up primarily within the NHS, and a combination of 148 such trusts actually are run under the National Health Service in England, and they provide the basic care or primary care, as we call it, to all members of public within England and Wales. Let's put it this way. So the PCTs or primary care trusts are largely administrative bodies, but they are also classed as local. They work very closely in tandem with local authorities like the council, the community service, the secondary healthcare services, and they are then responsible for essentially ensuring that services are tailored to and provided to members of the public within a particular county, a state, or essentially a borough. In our case, in England and Wales. Now, if we look at what is the role of local authorities in health and social care, we identify 6 key elements, which is what defines their role within this particular sector. They look at providing local leadership. They look at providing focus and strategy for implementing some of the national policies and tailoring them to a particular region, so that the public health services could be delivered to the members of the public in a more efficient and a more effective way. So they work very closely with the Public Health England, which is the other body. When we talk about essentially a government body, and they would be looking at following very closely some of the research and best practices which are given out as say white papers, as procedures from this particular body, and look at implementing this in their region. They look at also maintaining and developing key partnerships. They look at community collaboration. They look at making sure that the care which is being provided is built up on effective communication with key stakeholders within the community, and this allows any service which is provided by the National Health Service in a particular region. If I talk about Manchester, and if I talk about North Manchester, there will be a body, the local authority would be working with some of the key partners, key bodies within that area, to be able to ensure that all these services are delivered, meeting the requirements of people within that area. Now, last assessment criteria on this particular learning outcome talks about assessing the impact of poor quality service. If the service standards are not maintained, how does it affect the quality of service? Now, if you recall some of the terms that we discussed initially, things like medical lapses, looking at negligence, looking at malpractice, looking at delay in terms of providing information. These bits that we look at, which are basically lapses, medical errors, adverse events, medical injuries, medical mistakes, they will impact the delivery of services within this sector. So they can they are directly related to poor quality of service being delivered to the patients. So when we talk about accessibility of impact of service, poor quality service, we're going to be looking at understanding why does it fail? Why do these services which are which the bodies are trying to deliver do not meet the requirement criteria? Why? So when they don't meet the requirement criteria, what we essentially mean by that is that these services are essentially failing. That means they are not meeting the criteria which has been set by CQC, and in those cases, you would generally see that it will lead to some sort of let's say fatality, or it would lead to some sort of complication for the patient who is receiving the care. Now, because of poor quality services, the organization may also be adversely affected. That means poor quality of care can reduce, obviously, productivity within the organization. It can also mean a lot of additional financial resources have to be spent to maintain certain standards. If people do not understand how these services have to be delivered, it could be one such expense could be that more training has to be done, or more training and development has to be done for the individuals to ensure that they understand the level at which they need to provide this service, or the basic minimum level at which they are able to provide this service to the patient. Now, poor quality of service can also at an organization and reduce satisfaction. So in this case, customer satisfaction. So when you receive the service and you receive a survey, how did you receive the service? Was it meeting your requirement? Were you able to get better soon? Or were all the was all the information provided to you before the procedure or the service was provided? That would mean that if the standards have been cut and they have not been, proper procedures or standards have not been followed, you would generally see that it will reduce the customer satisfaction and maybe increase, sometimes we do get to see that a lot of patients go back and sue the NHS because they feel that the quality of care led to this fatality, or led to mothers, for example, having a miscarriage, or proper care not being provided, during, I think in Staffordshire Care Trust Hospital, in the last couple of years, we've seen that there's an investigation which has been opened by CQC, which has discovered that 70 or 71, if I don't remember the exact number, but 70 or 71 deaths happened during mothers when they were trying to, give birth. And that was down to procedures and policies not being followed, negligence. And this has meant that a lot of patients have sued the hospital for the poor quality of service which was provided and support which was provided, to mothers who were expecting at that point in time. Specifically, the shortage of consultants, which led to, stillborns or birth, being given by mothers as stillborns. And this is where, the impact of this, poor quality of service is clearly seen. Shortage of consultants, shortage of trained nurses, shortage of support which could have been provided and deaths could have been averted, leads to legal action, which can also look at, obviously, a lot of costs being racked up at the end towards the, primary care trust, in this case, the Staffordshire Trust. So in general, here, what we are looking at is taking up an example of how impact of poor quality of service can affect its stakeholders. So maybe taking an example of a recent incident which has happened, where CQC has opened up an inquiry and found the quality of standards have slipped. The primary care trust has been put under sanctions, and customers as a stakeholder have suffered. Would be a right example to take to discuss some of these, to discuss the assessment of the impact of poor, service quality. So sometimes you would see, again, an example here is that there is again a case which has come to the court, and I think the court has given in favor of the patients. There was some there is a blood transfusion scandal, which we normally talk about, which has happened in the early 1970s, wherein a lot of people who received blood transfusion later on were diagnosed with hepatitis B and, other chronic diseases. And the patients, obviously, in some cases, patients have passed away. The families of the patients had pursued this, saying that there was negligence in terms of, this should have been detected, and a lot of patients were affected. Maybe, I don't know, 3,000 patients were affected. And this led to the NHS and the Care Trust being sued by the families of the patient. And they finally won the court case after 30 years. And what has happened is this has led to a case of medical negligence, which means poor quality of service being delivered. And as a result, in this case, it could be services being delivered because of poor use of equipment, because of use of contaminated blood, which should have been, looked at or discovered by the blood bank. And multiple agencies obviously have been involved. And this would give you a perspective that obviously reputation has been compromised. A lot of fatalities have occurred because of that. The service which was being provided to the users, in this case, the patients, their families feel very distraught, and obviously feel that, this has taken far too long for it to be acknowledged. And it has created a lot of stress for people who are still living with conditions, and families and friends of patients who have had this blood transfusion and have developed complications, and as a result they have had to care full time for their family member, has clearly highlighted the poor quality of service which has been provided in this case for patients who are needing blood transfusion. And that would be the assessment of the impact of poor quality service by taking into account a particular stakeholder. In this case, we are talking about patients. If you talk about the negative aspects of what the carers have to deal with or have been dealing with because of the the impact of this transfusion scandal, or maybe talk about the impact of stress which the family and friends of the patients have gone through, would be the discussion on this particular point, which is assessment of the impact of poor quality service. Now, there are some additional readings which I would suggest that you should look at from a point of view of looking at I would say looking at this learning outcome. One of them is the role of local authorities. So I put a link down here, and I'm going to quickly show you some of these reports, and they would essentially be quite helpful for you to get a better understanding of the learning outcome one that we've discussed today. So just in case, if for those of you who are looking at reading into a bit more, the role of local government and the authorities in particular dealing with I would say their role in ensuring how quality of care is delivered and maintained. The other one wherein I'd taken the video from, which is quality of care from a perspective of the World Health Organization, is a good read that I would suggest that you should look into. And then in general, if you're looking at understanding about the quality of care and CQC in particular, I would say it'll be good for you to look at going to the CQC website and reading about CQC, what is their role, what is their purpose. It'll give you a bit more information on what we've discussed during the presentation. And similarly, you could go in and do a bit of reading on another organization which is considered as a key agency, and that is the SCIE, and it talks about what their role is in terms of being a key agency involved in delivering a perspective on quality and as an external agency responsible for setting standards in the UK, specifically in the context of health and social care. So I hope this session has been useful. And with this particular session, we have covered learning outcome 1 in a great amount of detail. And I hope if you have any questions with regards to today's discussion, feel free to email that to me at learnerwork@ukversity.co.uk, and I will pretty much come back to you on that with some additional information as required. So just very briefly, looking at this presentation, a copy of this would also be available up on Moodle, and in terms of what we've discussed. And if you think of any questions, then feel free to email that over at that particular address, and I will come back to you with some additional information. Thanks so much for attending, and